celebrations that's been happening now for a week. I'd like to thank very much Truman, Autumn for inviting me here and giving me the opportunity to be the moderator and to distinguished panel that we have today. We'll be discussing the effects of HIV, AIDS in the Caribbean islands. I'm going to start introducing the panel, and it will proceed from my right-hand side, right here. And this is Professor Monique Germain. Professor Germain is a member of the Faculty of the Nursing Science at the Nursing School of the University Episcopal de Haiti? Okay, the Haiti. She has worked with HIV, AIDS infected population in Haiti before and after the 2011 earthquake and has been very active in post-earthquake relief efforts. She received her Bachelor's of Science in Nursing from Rush University, Master's in Science from St. Xavier College, and is currently working on her doctorates in adult and higher education at Northern Illinois University. Her many leadership positions and membership include current president and board member of the Haiti Nursing Foundation, past president of the Midwest Association of Haitian American Women, board member of the Faculty of Nursing Science at the University Episcopal de Haiti, member of the Sigma Delta Tau Nursing Honor Society, and member of the Association of Nurses in AIDS Care. She has also served in a clinical mentor to nursing students and faculty in Swaziland, Southern Africa. The next person is one of my co-workers and a very great, wonderful person that I have the pleasure of knowing, and she is very in the HIV field, and that's Maritza Vidal. Maritza Vidal is a 54-year-old Cuban female who has been very active in the LGBT Hispanic community since 1975. In the 1980s, she started working with substance abusers and gang members in the several recovery homes, one being La Familia in Latino neighborhoods. In 2002, she joined the Puerto Rican Culture Center, Vida Sida, an umbrella agency. Vida Sida is an outreach worker and health educator. In 2005, she received the Peacemaker Award from Chicago Theological Society for her work with homeless and gang members. Today, Maritza is very much involved in the work with HIV, AIDS, hepatitis C, and sexually transmitted infections as a director of outreach at the Puerto Rican Culture Center for Vida Sida. Following, we have, excuse me, Dr. Susan Lowe. Dr. Susan Lowe is a Jamaican-American integrative general practitioner holding the Bachelor's Back Medicine, Back Surgery, and Bridget System Doctor in Environmental Studies, University of Wool, Canada, and an MA in Social Science with certified in Spanish translation, state fellowship from SUNY, those are the New York schools, universities. She practiced alternative medicine before becoming a Western-trained graduate of the Faculty of Medicine at University of the West Indies, formerly University College of London in the West Indies. She was administrator officer in charge of the academic restructure of the medical program of this institution. Her experience includes 30 years counseling experiences, including rape and abuse centers in New York and Kingston, and set up one of the first 5 counseling websites in the Caribbean. She has co-wrote the Manual on Care of the Aged for the Caribbean, sponsored by the UK Help Age. Dr. Lowe has much public health volunteer experience in the Spanish Caribbean, Pueblito, Canada, and formerly worked with the Jamaican Ministry of Health, New York Health and Hospital AIDS Nursing Education Project as a founding research assistant, and is now in private practice in Jamaica and consuls in Florida. And lastly, we have Ray Lewis Thornton. Emmy award-winning AIDS activist Ray Lewis Thornton rose to national acclaim when she told her story of living with AIDS in a cover story for Essence magazine. She has been living with HIV for 28 years and AIDS for 20. In the last 18 years, Ray has traveled worldwide in an unending crusade, challenging stereotypes and myths around HIV/AIDS. In addition to the December 1994 cover story for Essence magazine, Ray has been featured in countless magazines and newspapers. The Oprah magazine, Glamour, Women's Day, Ebony, Jet, Emerge, WOW, PAS, Lifelines, and HIV Plus magazine, the Chicago Tribune, Chicago Sun-Times, Washington Post, Dayton Daily News newspapers, to name just a few. As a contributing editor for WBBM-TV, a CBS-owned and operated television station, Ray won the Covenant Emmy Award for an ongoing series of First Persons Report Living with AIDS. Ray has been featured on several national television documentaries, news shows, and television specials, such as The Oprah Winfrey Show, Dateline, CNN, 106 and Park, Black Entertainment Television, The Montel Williams Show. She also was featured on Nightline with Ted Koppel numerous times in news articles entitled Ray's Story AIDS, The Next Wave in AIDS at 20 years. In 2009, Ray launched a line of bracelets, RLT collection, that she designed and made herself. Celebrities such as actors Sherilyn Ralph and Kim Coles, as well as Judge Glenda Hatchett, wear RLT collection. Ray Lewis Thornton was licensed as a Baptist minister in July 2000 at Fellowship Missouri Baptist Church in Chicago, Illinois, by the Reverend Clay Evans. She received a Master of Divinity degree from McCormick Theological Seminary in 2003. She currently is a PhD student at Lutheran Study School of Theology at Chicago. Ray graduated magna cum laude, graduate from Northeastern Illinois University. Ray is very proud to receive the 2011 Distinguished Alumni Award from her alma mater, Northeastern, as well as deliver the commencement address. Ray has received literally hundreds of awards for her work in HIV/AIDS in the past 18 years. In May 2012, Ray released her second book, The Politics of Responsibility. And this is your panel for tonight, for this afternoon. I'd like to at least give the opportunity to each panel to at least say something very brief from each one of you, so everybody can at least have a little opportunity to know you from your perspective. So we can start with you first.
I'm Monique, and I really have been involved with HIV/AIDS in the early 80s, right here in Chicago. I don't know if you remember when they had a big wave of Haitian refugees here, and all of a sudden they stopped dropping dead like flies. And we were all out in the neighborhood trying to figure out what it was. And guess what? It was HIV/AIDS. So since then on, I've always been involved in the community, but more recently, I've been involved overseas in Haiti, and I participate in voluntary programs. And the whole issue of, people being infected and affected by HIV/AIDS leaves a big door open for discussion, and this is why we're here today.
Thank you very much.
Hi. Please don't mind my throat. My vocal cords been bothering me. Also in the 1980, there was a big influx of Cubanos arriving in the United States, and that's more or less the same time I got involved in 1984 when I lost a total of 9 friends in 1 year. Now, after a few years and working with my Latino and Caribbean community, I'm beginning to work with the dissidents that are coming from Cuba and getting more knowledge about the epidemic and how it's being controlled in my Cuban island nation. Thank you.
Dr. Lowe.
I'd just like to say thank you very much for this opportunity. I really consider it an honor. I don't know exactly how I got here because something happened and I got here. But first I'd like to say to my English-speaking compatriots, hello from Jamaica. To my Hispanic colleagues, buenos dias. To those who are of Haitian background, this great, disrespect if you don't believe in it, but I happen to have learned several sacred Haitian dances. So I say, Papa Legba, Ouvri Bare Pumnu, which is, the Haitian God opened the barriers for us that we may walk through these things. And the understanding now that Haiti is so connected to Chicago, this is bizarre. And then to my Jamaican compatriots, Wagwan. I really hope we can unify this. I had really no idea that somebody was seeing this so much from the outside as this group, this is really a Caribbean worldwide thing, and that we need to get it in together.
Just happy to be here. The only thing I have to add is my beautiful Turks and Caicos suntan.
I was what?
Mama Ray turned 50 this year.
A young girl. A young chick.
All right, we're going to continue with the panel. I'd like to remind the panelists and everything that we are in a time frame. So we're going to ask you that when I ask any of the questions that you please try to limit your answers to about 2 to 3 minutes max. That's engaged so we can be able to share the information that everybody has, and also in the later on to give the opportunity for the audience to have a Q&A. All right, so we have different nations representatives here, so we're going to speak, and they'll be speaking about their country. So we're going to start off, we have a few questions. One of the things that we would like to know is, of course, let's analyze exactly when did the situation of HIV become a problem or recognized in your country, and what is the current stat and situation of HIV/AIDS in each of the particular countries that you represent. Dr. Monique Germain, you can start.
Well, I'm not a doctor yet. It's hard to say when exactly it became apparent, because the signs were there, but people weren't talking because it affected other organizations. As I said, in the 1980s, when the Haitians came as refugees here and they were sick, they were having problems, questions were being raised. Other organizations and other people that used to fly from here over there, names were being cited, and people didn't know exactly what it was. And besides, who knows what it was, and who really had any idea on how to attack it. Nevertheless, they were affected. It became really a national or international issue when really you had the Red Cross involved, when you had other groups involved, when you have entertainment groups involved. Remember, they have private casinos down there. So there are a lot of social issues and public issues that went on. Up until today, it's hard to look at, say, this country in the Caribbean region has this stat, that stat. From my perspective, it's good to look at it from a panoramic view, from Puerto Rico to Cuba to Jamaica and other countries in the Caribbean, because each and every one number affects the other country, if I'm right?
Maritza?
Hi. In 1983, there was a few cases reported in Havana with, the diarrhea, with the typical losing of the weight. And Comandante Fidel Castro went into the Institute of Health in Cuba in 1983, commanded Dr.